Hi, my name is Emily Lieberman, and today I'm going to be presenting to you a case study on childhood obesity on one of our patients. So, looking at the patient demographics, we can see that this patient is a 14-year-old female, and she has a history of a BMI of 28.9 with medical history of a fractured ulna at age 4 and seasonal allergies. Her family history includes obesity and hyperlipidemia on her mother's side, as well as obesity and type 2 diabetes on her father's side. Looking at the patient's lab results, we could see she has a glucose of 116, HDL-C of 36, and LDL of 113. The patient's weight has been increasing 10 to 15 pounds each year for the past 6 years, and the patient also lives at home with her parents and two younger siblings. So, looking closely at the patient demographics, going back to her BMI of 28.9, and a BMI of 28.9 would be classified as the overweight range. And looking at her lab results, her glucose of 116 is an elevated glucose, and anywhere between 100 and 125 would be considered as prediabetes. So the patient, based on her glucose, is at a pre-diabetic level. Her HDL-C of 36 is low for the normal range, and a low HDL-C can lead to an increased risk of heart disease and stroke. So that is something that is definitely highlighted in the lab results that is abnormal, as well as her LDL of 113, which is an elevated LDL cholesterol. So those three main lab results are the most abnormal. Everything else on her lab results showed normal ranges. So, talking a little bit about what obesity actually is and how obesity is classified, we could see that it is classified by the World Health Organization as a BMI over 30 due to an abnormal accumulation of fat. And some risks that come with obesity includes unhealthy eating patterns, stress, lack of sleep, and lack of physical activity. So, following an improper diet, not doing enough physical activity, lack of sleep, and stress, those are all risk factors that can eventually lead to the formation of obesity. And a big factor that plays into obesity is genetics and environmental factors. So, with genetic factors, obesity can occur in families according to a clear inheritance pattern caused by a single gene. And we could see in her family history, her mother's side has obesity and her father's side has obesity. So, this is definitely something that can be passed down to the patient. And then environmental factors that can play into the role of obesity include physical activity, the consumption of alcohol, socioeconomic status, of course, diet, and the parents and their feeding behaviors with the patient. So, alcohol consumption obviously is not something that would play a big factor into this patient since she is only 14 years old, but of course, her physical activity level, her diet, how her parents their feeding patterns at home, this is definitely something that plays a major role with this patient and why she may be seeing that BMI of 28.9 and having that obesity as family history as well. So, when looking at her nutritional assessment, we can see that the patient is above the 95th percentile for BMI for her age. So, an overweight BMI would be anything in the 85th to less than the 95th percentile, and then obesity would be anything above or at the 95th percentile. So, right now, she is classified as obese in her percentile for BMI for her age group. So when calculating her nutritional needs, I base it off of a maintenance of 20 to 25 kcals per kilogram per day for her energy, protein between zero point 0.8 to 1 grams per kilogram, and fluid levels anywhere from 20 to 25 milliliters per kilogram. So that came up to about 1,286 to 1,732 kcals per day for her energy, with protein from 55 to 69 grams per day, and fluids matching her energy of 1,286 to 1,732 milliliters per day. And this is based off, of course, of her weight and then the maintenance of the energy, protein, fluids that were calculated. So when looking at the patient's 3-day food recall, the biggest factors that were highlighted in the food recall was her diet consists of excessive fat, sodium, carbohydrate, and protein content, and the patient was not receiving enough fiber, vitamin A, and vitamin C from her diet, as well the patient consumes an excessive amount of sugar from her diet. So it's really important that this patient, especially for her age, is getting those essential fiber, vitamin A, and vitamin C's from her diet, as well as other vitamins such as vitamin B12, vitamin D, of course, because fiber, as we can see in the picture, there's benefits that help with promoting weight loss, lowering the risk of type 2 diabetes, and it decreases acid reflux. So it has a lot of beneficial factors, as well as the vitamins that are beneficial for, the skin, immunity, eyesight, etc. So it's definitely important that she limits the amount of fat, sodium, and sugar that she's getting from her diet, and in turn replace it with more foods that give her that beneficial fibers and vitamins that she is missing from her diet. So, some nutritional interventions that I believe are realistic and things that the patient and her family can work towards is following a MyPlate daily diet that's consisting of 1.5 cups of fruit, 2 cups of vegetables, 5 ounces of whole grains, 5 ounces of protein, and three cups of dairy. So, of course, the MyPlate guide on our right is a great tool that the patient can use, and it can show how much fruit, grains, vegetables, protein, and dairy she should be getting in her actual diet. And then, of course, following 60 minutes of exercise per day, which is recommended for her age group. So, exercises, of course, can be including walks, swimming, going for a run, bike rides, etc. It's really important for kids her age, especially with her BMI, to start that exercise on a daily and get into a routine of following that exercise daily. Of course, drinking 1.3 to 1.6 liters of water per day, or about 8 to 11 cups, 64 ounces. It's really important that she gets that hydration in her diet, especially from her 3-day recall. I was noticing she was lacking a lot of that hydration and water intake. So I think by her dividing it through her meals, where she's able to, divide it with 2 cups on breakfast, 3 cups at lunch, etc. So she gets at least that 8 to 11 cups per day will definitely help with improving weight loss, overall health, and just making sure that she's getting enough fluids that are needed for her to remain healthy as well. And then I want to throw in just a SNAP program that could be beneficial for both the patient and her family as well. So the SNAP program is a program that provides food benefits to low-income families to supplement their grocery budget to afford nutritious foods. I believe this could be something that's beneficial to both the patient and the family, because I know when the patient and the family came in, one of the biggest struggles that they had was being able to afford nutritious foods, which is why they oftentimes go for the more sugary and high sodium fast food diets, because it is obviously more accessible and easier on them. But I think through the SNAP program, this is a way for the family to be able to afford those groceries and be more realistic with how much they're able to spend, have a set budget, and be able to get more of those fruits, vegetables, grains that are definitely needed for the patient, and it could be very beneficial as well to the family. So I definitely would recommend for the patient and the family to just look into it. So it could definitely help with supplementing that. So, yeah, overall, I would say that as long as the patient follows a good diet, she implements exercise, she's getting her hydration in, there could definitely be good changes that are being seen. I would suggest for the patient to follow up after 2 weeks to see how it's going, be able to modify the diet as well, and see if there's any changes that can be made from both ends so the patient and the family can be happy overall.